Assalamu alaikum everyone. My name is Mr. Ali here with the real story. I hope you're keeping well and enjoying the fantastic weather, albeit a bit cooler today. Today we have the main man himself, the Director of Public Health, Dr. Justin Varney, in the studios to talk about the latest Indian variant as well, what's causing the increase in spike, and also in terms of some of the hesitancy within the BME community, and also the mobile vaccination unit here in Alum Rock. Dr. Justin Varney, the man of the moment, real warm welcome to you on the Real Story on ZMC Network. Thank you. I hope you're keeping well. I know you were saying you're a bit sort of hay fever. We won't keep you too long, but real thank you for coming on. I'm going to sort of hand over the platform to you. We've got a huge array of Asian listeners and viewers on our studios. It may be worth just giving us an indication of what's happened over the last 3-4 weeks with the Indian variant, or otherwise known as the Delta variant, into what's happening to the number of positive cases.
Sure, and thank you very much for having me. As you've said, we are seeing quite rapid increases in the case rates in Birmingham. We're now up to a case rate of over 95 cases per 100,000 and over 1,000 new cases of coronavirus in the last 7 days. Over 98% of the new cases are the new Delta variant, and this Delta variant we know is more infectious. It is also now appearing to be more dangerous. So a larger proportion of people who catch the Delta variant end up in hospital compared to the old variants and the original version of COVID. What is good news is we know that the vaccines, both AstraZeneca and Pfizer, are over 95% effective at stopping you dying or ending up in hospital after you've had the second dose. And it takes about 2 to 3 weeks after that second dose for that protection to come in. But we're seeing very, very, very small numbers of people who've had 2 doses die or end up in hospital. What's not quite as good news is we do see that people who've had 1 dose of the vaccine can still catch COVID, and a small number who've had 2 doses can still catch COVID. And that's why it's really important that even if you've had the vaccine, you still keep testing and you still keep following the rules. I'll talk a little bit about Alum Rock itself. As you know, this is one of the areas where we have been concerned about case rates, and we are seeing case rates continuing to increase. And just looking at the most recent data for Alum Rock, the case rate in Alum Rock is now over 170 cases per 100,000 population. And that's about a 19% increase compared to the previous week. So it's still going up. However, what is really good news, and I'm really pleased about this, is that the testing rate in Alum Rock is going up now as well. Alum Rock was one of the areas of the city where testing wasn't great. And actually, I think where we've been going door to door, giving out testing kits, and all the work that people like Mr. Ali in the community have been doing, you guys are now testing twice a week like we ask, and that testing rate is now over 5,000 tests a week per 100,000 population. I need it higher than that, but it's a really good start.
We've had a lot of calls. Sorry, we've had a lot of calls this week because people weren't aware of the surge testing and said, who are these people giving us tests? Are they all okay? I said, yes, absolutely. Please give yourself a test. That seems to have worked, but we just got that room for improvement a bit more.
Yeah, and one of the things we've also now know is that if you don't like using the test in the back of your throat, if you blow your nose before you use the test up your nose and you swizzle it round in your nose just a little bit longer, so really you want to be doing each nostril kind of 20 seconds each side, that's as good as doing your throat and your nose. So we know for some people, they don't want to do their throat. So if you blow, you have to blow your nose so it gets the virus into your nose. So blow your nose first and then do each nostril 20 seconds and then with the kit. That's as good.
Sure.
So the other thing that's really good actually is that vaccination is improving. And what I'm really pleased about is that now over 70% of the people aged over 60 in Alum Rock have had their first jab of the vaccine. I need it up to 90% to be sure that this Delta variant is not going to cause more deaths in Alum Rock. You've already had too many people die in your community.
Absolutely. Absolutely.
And the vaccine will stop this. But the fact that we're now over 70% in the most elderly is really good because, 2 months ago, I think we were still down in 40%, weren't we, Mr. Ali? It was a big, it's been a big push.
And I think these mobile units have really helped, Dr. Varney, and also the fact that there's availability of the Pfizer vaccine as well. People seem to be a lot more confident and reassured with the Pfizer vaccine as opposed to AstraZeneca, even though it's only a small number of people that got the blood clotting, but it was in the news and the media, and as you know, people do get a bit put off by that.
Yes, absolutely. And the vaccine mobile unit will be at the Saltley Learning Centre tomorrow. And then on Saturday, it's now going to be at Norton Hall. We've had to move it from the Learning Centre where it was going to be on Saturday. What I would say is and it's going to be about 10 till 2 every day. And it's Pfizer. And that's open for anyone. You don't need to bring ID. Just turn up and they will help you, talk you through the registration system. It's really for people who are due their first dose. But if you have, and we need people to have the same vaccine each time. I was just on a national meeting actually where they were sharing some of the research from the trials where they've been trying to mix the doses. And what they found at this stage, and the trial's not completed, is that if you mix the doses, people have bad side effects with the second dose.
Sure.
So normally you don't get bad side effects with the second dose. If the first dose was fine, your second dose is normally fine. But mixing them up does seem to make the side effects worse. So stick to what you had the first time. The other thing that's going on this weekend is Aston Football Club. Saturday and Sunday, anyone who's 18 to 39 can go there and get their jab, and that's going to be Pfizer as well. So what I'd say is for the young people of Alum Rock, and I know for some of you won't be Villa supporters, but please get over it and go up to Villa and get your jab there. And for let the ones that are over 40 use the pop-ups that are in the Learning Centre and at Norton Hall. It doesn't matter if you have to use those, but if you can get to Villa and you're under 40, please go and get your jab there because there's more people vaccinating there. And more vaccines going to be there, so it just helps take the pressure off.
And just to give you some feedback on the benefit of having these mobile vaccination hubs, people are finding a lot more receptive. The fact that they don't have to ask their grandchildren or their daughters or their sons to book an appointment and take them to those units, and then having the translation and everything. Here, they can just rock up and get themselves vaccinated themselves because there's no booking online or having anyone to interpret. So they've been really receptive, and I'm hoping that tomorrow and Saturday is also equally as effective as the one in Lozelle and also in Ward End as well. I mean, I know it's more under the BSOL CCG, but from our point of view, please do give our feedback that it's been a real success in our communities. Yes,
absolutely, and we're seeing that in the numbers. And often people, and we need to be honest about this, there are some people that don't have the right documents, aren't registered, and we are seeing that the pop-ups help them as well, because the vaccine is free to everyone. Doesn't matter what your passport says, doesn't matter how long you've been in the country, we want you vaccinated. And the pop-ups have really helped with those, for those people as well. We are going to be looking at more of these and longer hours as well, because 10 till 2 is not great for everyone. So that's there will be more of them. But please do take the opportunity. And I think you saw in Ward End last time, if there's a good turnout, then we get them to stay a bit longer. So, please do turn out and make use of it.
Fingers crossed. And the other thing that I will also say with regards to these mobile units is when I went into the ward and got myself vaccinated, and you know what, the pressures of life and your workload was the only reason that was stopping me, and then having to sort of go online and book it. But when I knew all I had to do was turn up when it suited me, and within 10 minutes, because obviously they were prioritizing local residents, I was vaccinated, and that really was just tailoring the service to the needs of the local community, and that's our end goal, is to get people vaccinated, and just sort of work around them rather than having it so this is how we work and you got to fit in to us. And the other thing I would also say, Dr. Justin Varney, is I know some of these vaccination hubs have been advertised using your Healthy Brum and the BSOS CCG channels and platforms. With all due respect, some of the the harder to reach communities don't have access to maybe Twitter or those sort of platforms. Do use the Radio Archivars, my platforms and other platforms that have that reach. And it's just makes today I must give a real shout out to Ikram Mirza, the owner of the radio station. He has been going to every shop, to every individual, to get that mobile unit promoted. And you know what? We will have a lot of people there tomorrow, Dr. Justin Varney.
Yeah, absolutely. And we are reliant on you, the other COVID champions that we have across the city, local radio, Facebook groups, community groups. We're trying to get the information out to you as soon as we can. Sometimes things have to change because of staffing and the sites. So it is important we use as many routes as possible to get that information out, because I think we want you to take the vaccine because it will stop you getting sick and dying. There's no secret here about why we're trying to do this. The other thing I do want to say, if people have got medical conditions that you're worried about, so often I get asked, I take blood thinners, can I have the vaccine? Answer is yes. I take blood thinners because I had some clots earlier in the year. I had my vaccine absolutely fine. Just tell them when you go, because they'll make you wait around a little bit longer just to make sure that the bleeding's not big. We know also people that have got needle phobias or particularly mental health problems, talk to your GPs, because sometimes going to these vaccination sites can be a bit scary. There's lots of people, and the pharmacies and the GPs now have more vaccine as well. So if you have got health concerns or you're quite anxious about this, do talk to your GP about going to your GP practice as an alternative from one of these bigger sites, if that makes you feel more comfortable.
Yeah, absolutely. The question that's just come through now is that someone who's in their mid-20s, relatively fit, has not caught the COVID, doesn't live with any elderly parents, and his concern is that why should I possibly expose myself to a unknown quantity into and a foreign body into my system when I am doing all the social distancing? Is the benefit versus the risk still outweighing those younger people as well?
Yes, I mean, it does. The benefit still outweighs it when you look at hospitalization. Deaths are unusual in young people, but they do happen. And sadly, we have had deaths in children and in young people across the country. It's rare, but it does happen. The other thing I would say to him is, What we're increasingly seeing is long COVID. So people have COVID, they have very mild symptoms, and then 3 months later, they still have extreme fatigue. Some people are developing heart murmurs, problems breathing, and the age profile of people with long COVID is much younger. It's people in their 20s, 30s, and 40s. It's not the group that went to hospital or end up in hospital. So I would say if you're younger, the reason to get it is because of long COVID rather than the death and dying. You're much more at risk of long COVID at a younger age, and that's the reason I think it's better to protect yourself.
Yeah, most definitely. And earlier in the week, Dr. Justin Varney, we had our Prime Minister Boris Johnson come on the national platform and told us that because of the new cases of the Indian variant or the Delta variant come through, he's had to push back the Freedom Day, so to speak, by another month. And I suppose with the data that you shared, you're obviously in full agreement with that decision and by the SAGE committee as well.
Yes, absolutely. And I'm conscious there are some increased freedoms now, particularly weddings. And you know, Birmingham loves a big Asian wedding.
Definitely.
But please respect that the wedding venues have to follow the rules. There are still things that they have to do to keep you safe. And the advice for Birmingham at the moment is only really leave Birmingham or have people from outside Birmingham into Birmingham if it's absolutely essential, like work or school or going to a health appointment. And if you are having people coming to visit or you're going to see other people, please do a lateral flow test on the day. And a wedding would be a really good example of that. Doing a lateral flow test before you go to a wedding would really help keep everyone safe. So testing is a really important part of what happens over the next couple of weeks before we get to that July relaxation.
Yeah, absolutely. I think a lot of people had cancelled their engagement or their wedding numerous times, and it was a relief that Boris Johnson now, this time round, mitigated weddings, although with a caveat saying that, you know, the venue's responsibility, how many people it will be allowed depending on the size, and only still 6 people per table. And furthermore, you mentioned about the singing and the dancing, which is very well known within the Indian weddings as well. That has to be restricted. But I'd rather have but then have the weddings taking place as well. It's about being sensible at the same time. But with regards to the overall situation with some of the other freedoms that were, you know, have been sort of put back, and with the travel restriction, you mentioned about, you know, people moving in and out of Birmingham. That's not very well known, Dr. Justin Varney. So it may be worth just, you know, clarifying that. So anyone who's in Birmingham should only really leave Birmingham, you know, whether it's emergency, otherwise stay within this particular geography of ours.
Yeah, so it's advice, and it's important to say it is advice, but the advice is really don't leave Birmingham unless you have to. So if you work outside of Birmingham, work's a reason to go to your job, that's fine. If you go to university or school, that's fine. But do your shopping in Birmingham, go out to a restaurant in Birmingham, see your friends in Birmingham over the next month, and leave the ones that live in Worcestershire or out in Leicester until after the end of July, because given the number of people in Birmingham with the Delta variant at the moment, there's a real risk we can spread it further to the rest of the country and put those people at risk. So spend your money in Birmingham, spend it in Alum Rock and support local businesses rather than taking it somewhere else.
Yeah, most definitely. And in terms of the deadline of the 19th of July, do you think that's realistic, or do you think, I mean, I'm asking you to sort of look into a mystic ball really, but do you think there's a chance that that may well be extended once more?
I think it is realistic if we can get the vaccination rates up. So the government have said what we're aiming for is 75% of all over 18s vaccinated by that July date. And just looking at Alum Rock at the moment, if we looked at all over 18s in Alum Rock at the moment, I think, give me 1 second while I get the computer to do its magic.
Yeah, sure, no problem.
We are probably running at about, this is where I have a screen slightly to the left of me, which I can see things on at the same time. So in Alum Rock at the moment, of all over 18-year-olds, only about 40% have had the first dose. So in order for us to get to that July date, we've really got to get that up.
And how do we compare generally within areas like Alum Rock compared to the overall UK population? You mentioned we're roughly about 20% lagging behind, and we are sort of trying, our best to get those numbers up, and we are slowly getting there. But I suppose the quicker we get there, the quicker we are out of lockdown as well.
Yeah, and I think we're certainly lagging behind the rest of the country. Alum Rock's in the bottom kind of 10 areas in Birmingham.
Yes.
So I would say, we are lagging behind. And Alum Rock is in the kind of 10% of areas that are kind of lowest in the city, but you are doing better, and that's getting better every day, which is really good. And it's down to all the community work that's going on. In terms of why people are not taking the vaccine, I think there are 3 reasons. There's a small number of people that it doesn't matter what we say, what the research says, they will never take the vaccine. They don't believe in medicines. That's their choice. There's quite a large group of people who have health problems and have questions about how the vaccine works for them. So that's like people who are on blood thinners that have a question about, will I bleed because I have an injection? The answer is no, it's perfectly safe. And there are also people who want to ask questions about the fake news. So, there are all these myths that it will impact on your fertility. There is absolutely no evidence of that. There is no scientific reason why it would. The vaccines that we use the same kind of technology as other vaccines have for over 30 years. So they haven't impacted on fertility. So why would it be different this time? And the new bit of the Pfizer vaccine is not the bit of the virus that's injected, it's the envelope around it. And that's not going to impact on your reproductive organs either. So there's a group that in the middle have got some questions, and if we can answer those questions, they'll have the jab. And then there's a group where it just hasn't been convenient. And it's a bit like you were saying, when you had the pop-up, when you could go and get your vaccine, you were in and out in 10, 15 minutes. And by getting more and more of that easy access to people, that is really helping. So it's that group that have got questions. And if you've got questions, first starting point is your GP or local pharmacist. And then the second group are the group about access, and we're trying to change that with the pop-ups. There'll always be a group that refuse, but if we can get more than 90% of the population vaccinated, then this becomes like seasonal flu, and we can tolerate that level of death and hospitalisation, and that's what we're trying to get to, is to turn this into seasonal flu and avoid having to lock down again.
Yeah, we've got about 5 minutes left now, Dr. Justin Varney. Just to think about, some of those fake news that were being propagated earlier on. Certainly, someone who's attuned to social media, that certainly has now sort of slowed down now. Stuff like, oh, it's not halal. It hasn't been tested long enough. When you've got roughly about 40 million people that have now been vaccinated their first dose, 30 million with their second dose. If there was anything wrong, we would have had, that sort of appearing on news and also in the post-injection studies on a regular basis. But there's also some conversation about school children being vaccinated as well. There's still sort of talks. I haven't had anything really clear cut yet. But what are your thoughts about, maybe secondary school children or 14 and over being vaccinated?
So nationally, they're looking at the science, and it is a benefit versus risk. There's no evidence of risks of the vaccine to children, but we also include the fact that children don't like having injections. I mean, none of us like having injections, but if we try not to put children through things that upset them if we don't have to. So that's a national decision. Birmingham said if the national decision is children should be vaccinated, we want to be front of the queue. We have more children than anyone else in the country, and we have over 300 schools in the city. So we need time, and we need to be at the front of the queue to be able to work out how to do this and work with parents so they understand. The other thing we've also asked for is to be able to be front of the queue protecting children with disabilities. As you know, we have lots of disabled children in the city, and the evidence is clear that adults with disability are at much higher risk of dying or ending up in hospital if they have COVID. And I want to be able to protect our children in the way we can protect our adults if the National Committee says the vaccine is safe and it's right to use. So that's why the council and the local NHS have said, if National say children can be vaccinated, we're fighting to get Birmingham at the front of that queue to protect our children.
Yeah, that's great, Dr. Justin Varney. We are now towards the end of the show. I'm just going to allow you maybe a minute just to sort of gather your thoughts and leave a final concluding remarks for our viewers.
What I would say to everyone watching is we've had a really, really terrible year. COVID has hit the city hard. It's hit Alum Rock hard, both in terms of the people who've died, the people who've ended up in hospital, the businesses that have been hit hard, the jobs that have been lost. We have light at the end of the tunnel, but in order for us to get there, we have to get more people to take the vaccine, and all of us need to test twice a week with the lateral flow, even when we've had the vaccine, because this new Delta variant is dangerous and it is spreading fast. And I really want to see Alum Rock demonstrate a community that comes together and can close the gap, because this is about protecting you, protecting your families, and protecting Alum Rock. So work with us, go to the vaccine sites that are being opened up over the weekend, take the test when they're offered to you, and help us get it under control to protect you and your families.
On behalf of everyone in Alum Rock, Dr. Justin Varney, a huge thank you and your team, and we will do our bit to make sure that we work hand in hand to get our people vaccinated.
Thank you, and thank you very much for your support and having me tonight.
Thank you very much, sir. Thank you. Cheers. Bye now. Bye. That was Dr. Justin Varney giving us a real plea on behalf of himself and his team in order as to the reasons why we should be vaccinated. So tomorrow, Friday, there will be a mobile vaccination at the Saltley Adult Education Centre, which is on 80 Anthony Road. The postcode is B83AA. Anyone that is over the age of 18 will be eligible and will get the Pfizer vaccine. You don't need any kind of ID. All you need is your details, and you will be administered dependent on the queue. And then you will have to wait 15 minutes after the injection, and then you will be allowed to go home. Same with Saturday. You will have the chance to have another chance to get yourself vaccinated, but this time at Norton Hall on Ralph Road as well. Please, again, anyone over the 18, you will get yourselves vaccinated. So please, unless we are all vaccinated, no one is vaccinated. We have high numbers of COVID, but low numbers of vaccination. And as you heard from Dr. Justin Varney, it is only for those that have been vaccinated that will not suffer the severe symptoms of coronavirus or will go into hospitalizations because of their symptoms. I hope you found the show useful with all the data and the best practice from Justin Varney. Look forward to seeing you tomorrow and Saturday in Alum Rock to get yourselves vaccinated if you haven't done so. Until next week, God bless, look after yourselves and each other.